DLCO or TLCO, is the extent to which oxygen passes from the air sacs of the lungs into the blood. Commonly, it refers to the test used to determine this parameter. It was introduced in 1909. Mechanism of the DLCO test. This test involves measuring the partial pressure difference between inspired and expired carbon monoxide. It relies on the strong affinity and large absorption capacity of erythrocytes for carbon monoxide and thus demonstrates gas uptake by the capillaries that are less dependent on cardiac output. The measurement of DLCO is affected by atmospheric pressure and/or altitude, and correction factors can be calculated. Expected DLCO is also affected by the amount of hemoglobin, age and sex. Factors affecting DLCO. Decrease. DLCO is decreased in any condition which affects the effective alveolar surface area, hindrance in the alveolar wall. For example, fibrosis, alveolitis, vasculitis, decrease of total lung area, for example restrictive lung disease, chronic obstructive pulmonary disease, due to large residual air stuck in the lungs, uneven spread of air in lungs, for example emphysema, pulmonary embolism, cardiac insufficiency, pulmonary hypertension, bleomycin, chronic heart failure, anemia due to decrease in blood volume, amiodarone high cumulative dose. More than 400 mg per day. However, many modern devices compensates for the hemoglobin value of the patient, and excludes it as a factor in the DLCO interpretation. Increase. Factors that can increase the DLCO include polycythemia, asthma and increased pulmonary blood volume as occurs in exercise. Other factors are left-to-right intracardiac shunting, and alveolar hemorrhage. Factors affected by DLCO. Decrease a DLCO of less than 60% predicted portends a poor prognosis for lung cancer resection. FEV1 is of lesser prognostic value for lung resection survival. References. External links: Medline plus Encyclopedia 003854.